Well, I think it's okay. Thank you for the introduction, and I think I cannot see much with all this light, but I'm very honored to be here, and I wish I could stay the whole period. I know yesterday there were great discussions, and I think my participation here, and dear colleagues and participants of this Forecasting Health Futures Global Summit. First, I really thank you for the invitation, and I would like to say what I'm going to do here is to share with you this preliminary and very early version of this, what we call the COP30 Climate and Health Action Plan that Brazil intends to submit to the formal appreciation of the UNFCCC parties. This proposal is to build and shape the Belém Health Action Plan, that's the way we are calling it, in a very participatory process. And what we want is to reach this technical and scientific consensus and support from the public health experts, the academia, the civil society, for this crucial effort to strengthen the adaptation of the health sector to climate change. So I like one idea, and that was shared by the Ambassador Andrea Aranha Correia do Lago, the president of the COP30, and he has called for a global mutirão. And this is a very special word, and this means urging international cooperation and action to address the crisis. This word mutirão is a Portuguese word derived from an indigenous word motiro, and this means getting everyone together, all the people together, to solve complex collective problems. So I think we need really a global mutirão to address what we need to do with climate change. As we prepare for COP30, we must ensure that it's people-centered conference, and we need to really work on this collective action that this should drive our efforts. So it's not about the negotiations only. We need to go into how to do things and how to really build an agenda that everyone agrees with and that we could move forward. So if we want to have an inclusive, evidence-based and actionable plan, we must move beyond negotiations and focus on the implementation. The health sector has a pivotal role, not just in responding to climate impacts, but in leading the transformation toward care, repair, and resilience. Through discussions on health equity, adaptation finance, evidence gaps, and shared COP experiences, we are willing to work together to strengthen the foundation for health-centered climate action, which will define the path forward for adaptation within COP30 and beyond. So, the thoughts I will share with you today are a work in progress, so it's not the final work. And we are starting early, actually. We already had some consultation on this process, and I hope this will encourage you all to find ways to contribute to this collective process, which aims to protect lives and ensure a healthier, more resilient future for all. So, I don't know, yes, I have there. And what I will do is walk you through what we have been discussing, and some of you participated in the consultation. But I promise I will not take too long, so we have time to discuss. I think we have time to discuss this later on. Oops. So what we want to do is to work on this proposal for a plan to adapt the health sector to climate change. In these builds, it's not something that starts now, so we build on past initiatives since COP26, COP27, and 28. Also, the WHO resolution and all the work plans that we have been working collectively as well. And it's aligned with the UA Belém work program to advance the global adaptation target. And you see there are different groups working in the formal discussions of the how to build adaptation plans in the COP process. So the objective of the action plan is to outline the adaptation strategies that will enhance health systems resilience, ensure service continuity, and reduce climate-related morbidity and mortality, particularly to the most vulnerable populations. Why we say that? Because the way to make visible the ones we need to cover the most is to put this central in the plan. So that's the reason we work with a very strategic alignment with all the work done previously, particularly with what was the Climate and Health Coalition, so Continuity Coalition, to make sure health is central in this discussion, but also the commitment that we have been working in Brazil, and so it's based on the work we have been doing. We take out of this experience and we propose to work in actually health equity and leadership and governance in climate and health with social participation as a fundamental part of the process. So this is the cross-cutting axis of the plan, because we think if we don't bring equity at the center of the discussion, we will not make visible what we need to do. And then the main lines of action, it's health surveillance and monitoring, evidence-based policy strategy and capacity, and innovation. There's no way you can move really forward if we don't work seriously also on innovation. Not doing more of the same, we cannot really tackle the problems we have. So in health surveillance and monitoring, we were willing to work on improving surveillance in early warning systems and identify a priority list of climate-sensitive diseases and conditions and developing strategies to address them. It's not that the lists are not there, but how we what we prioritize in the action. So the evidence policy strategy and capacity building, also to think how we have a taxonomy of terms that are related to adaptation, but talking to the health sector, if we need to improve how we talk the same language. A smart workforce to deal with climate change. So there is no way you can do this, all this work if we don't have a full involvement, engagement of the workers in the health sector. Promoting community resilience and climate change awareness for the same and one reason. There is no way we can actually address adaptation and increase resilience if we don't involve the communities. So it must be gender responsive adaptation policies. It has to be multi-sectoral. So what we need the ministries of health to do, but also how we talk to others, what are the best policies, what are the policies, adaptation policies or mitigation policies that best serve to health. So we need to be able to measure that as well. And adaptation for workers' health. That is a new thing that we need to work much more if we want to be effective. So the innovation has to do with building resilient infrastructure, but also health programs informed by climate change. So even to keep running services and programs, we need to think very smart how to do that. And compiling evidence on adaptation interventions in the health sector, it's needed because even if we don't know much, much of the research has been done in addressing impacts and trying to measure what is added by climate change in the risks for disease. And we change that, and we think even if we don't have the evidence, decisions are made. So we need to build a process and how we use the best evidence available to make our interventions more effective. And adaptation for just transition. So in one way, we need to translate what we talk about, equity and social participation in all aspects of the plan. So in the lead of COP30, what we will do is to engage in a series of consultations in this process. And that's, I think, important. What I'm doing here is also making it public. We are in this process. So the participatory consultation, it's not only with the stakeholders, the ones that are parties of the convention, but it's engaging not only in the UNFCCC constituencies, but also the whole public health and environmental health, and people working with us to secure that we do have agreements on what to do. So the strategy for the implementation is to develop this broad support or the agreement of what is science-based now and how we can strategically have a menu of good options for policies that will support the plan, and also how we mobilize the health and climate advocacy, so civil society, how we engage really in this participatory process, and also for the implementation, how we mobilize the civil society. And this will use also the experience in bringing this discussion, as we did, Brazil has proposed and passed a resolution at WHO about participation in the health sector, in the whole process of decision making of the health sector. So just to give an idea, we already had the March meeting, 18th and 19th, and I must say I was very pleased to see 117 people present in person and 70 participating 2 days online and making interventions and sending some comments and ideas for the plan. So this is a very early consultation. We are hoping to have a new moment during the World Health Assembly, and we are organizing this conference with WHO in July 29 to 31st, the Global Conference on Climate Change and Health. And this is a very important moment, so it will be the attached community together with a much broader audience to discuss then not only the plan, but what I was mentioned, coming out with documents that will support actually not only the discussions of the plan, but also the implementation of the plan. And then hopefully we'll get to the UN General Assembly also to have a moment for discussions of the plan, and come at COP30 with a broad support from UNFCCC constituencies to have this plan approved, and voluntarily everyone will agree to follow the plan. So this is what we are preparing. So we hope to have this action plan on climate change, adaptation, and health. We'll have a set of policy documents synthesizing the best available scientific evidence and no regret policy to support the plan. and a synthesis of existing experiences and these participatory processes. So we have our own in Brazil, but we know there are many others existing in the world. So we're putting it together to help others that want to follow the same process. So, obrigada. Thank you.